Madam Mayor London Breed, Health Director Dr. Grant Colfax, Director of Department of Emergency Management Mary Ellen Carroll, and the Director of Homelessness and Supportive Housing Abigail Stewart Kahn to discuss the poor air quality in San Francisco due to the Bay Area wildfires. As a friendly reminder, please keep yourself on mute and turn off your video to avoid any distractions. You can submit up to 2 questions by chat only. Please submit your questions as clearly as possible and include your name and outlet. We will do our best to take your questions in the order received up until the Q&A begins. We will happily take any remaining questions by emailing dempress@sfgov.org. Welcome, Madam Mayor.
Thank you very much, and good afternoon, everyone. Fire season has unfortunately begun in the state of California. And with that, here in San Francisco comes challenges with our air quality. In a normal year, we'd be able to focus entirely on these air quality challenges. But as you know, we are not in normal years. We are living in COVID. But even as we've been focused on responding to the COVID public health emergency, we haven't lost sight of the need to be prepared to respond to other emergencies. Whether that's an earthquake or an air quality event due to wildfire smoke in San Francisco, we know we have to be prepared. Now, I want to start first by recognizing that while our air quality here in the city is a challenge, we have to focus first on those communities that are being impacted by the fire. When people's lives are at risk, when their homes are at risk, that has to be the top priority. We all have friends and family all over the Bay Area and California. Our communities are connected, and we are there to support each other during these very difficult times. Just as we've done by providing hospital beds for counties overwhelmed by COVID, San Francisco is proud to be able to offer mutual aid for other jurisdictions that are currently battling fires. Recently, we sent the San Francisco Fire Department support to Salinas to assist with the river fire, and we will send support and personnel wherever we can in the weeks ahead. We do this because we care for our neighbors, and we know that when it's San Francisco that's in the eye of the storm, they will be there for us. With that being said, we are still 100% focused on keeping the people of San Francisco safe and healthy. Unfortunately, we've been through this before. In 2018, following the Camp Fire, when our air quality was severely impacted for days, I issued an executive directive to strengthen San Francisco's response to future air quality emergencies and other weather-related events. As a result, we revised and improved our air quality emergency plans. This plan includes specific strategies to reach out to our most vulnerable residents, especially our seniors, including working with existing community networks to get the word out and make sure people have the information they need. We all need to look out for one another and make sure that our residents know what to do to stay safe. Right now, our air quality is red, which means the air is unhealthy. We know this can shift, and we will continue to update the public as things change. The best thing you can do is avoid exposure to outdoor air by staying indoors with the windows and doors closed. For those of us who are fortunate enough to be able to work from home, please continue to stay home as much as possible. It is important both for the slowing of the spread of COVID-19 and for minimizing your exposure to poor air quality. But we know that not everyone can stay home and that we need to take steps to protect our unhoused residents. Abigail Stewart Kahn from the Department of Homelessness and Supportive Housing will provide an update on what we are doing for our homeless residents, but we are prepared to do everything we can to keep people safe. As with COVID, our ultimate goal is to keep the public informed. When we have information to share, we will share it. The effects of climate change are already being felt. And sadly, we know events like these are only going to become more common with drier weather and hotter temperatures. But we will do everything that we can in this city to keep people safe and healthy. We'll be providing updates throughout the day online, and we'll continue to update the public over the coming days and weeks with more information. If you have any questions or concerns and you don't have access to the internet, please call 311. And I want to thank the people of San Francisco for continuing to do what's needed to protect public health and for listening to our public health guidance. And to be clear, we are still on the state watch list around COVID. We anticipate, hopefully, maybe tomorrow, we may no longer be on the state watch list. But in the midst of these wildfires and everything that we're dealing with, we have got to use common sense and good behavior if we want to beat back this virus and make sure we make it through this challenging time with this poor air quality. So please don't forget, wear your mask, keep your distance, cut back on your social engagements. Make sure that you are taking care of yourself, your family, and your community. We all play a role in ending COVID in our city. And now I'd like to take this opportunity to introduce Dr. Grant Colfax, who will talk more specifically about the health impacts of COVID as well as air quality. Dr. Colfax.
Seems like Dr. Grant Colfax is having some technical difficulties. Director Carroll, if you're ready, we can take your update for now.
I am ready. If someone wants to start the video, I'm ready to go. Thank you so much. And thank you, Madam Mayor. Today, as we've already stated, we are experiencing poor air quality with smoke and ash visible throughout the city. We have faced hazard after hazard in this year, in 2020, and our city has been prepared to respond to multiple incidents we face during this time of COVID. In the past 7 days, we have dealt with a heat wave, rolling power outages, lightning and thunderstorms, rain, and now poor air quality as a result of those wildfires. We have been and we will remain prepared to tackle multiple hazards while continuing to respond to the global COVID-19 pandemic. And San Francisco's COVID Command Center will lead the city's response to these types of multiple simultaneous hazards. Our response levels for poor air quality will vary depending on the amount and impact of smoke particles in the air. If the situation gets worse, our response levels will increase. We have already put our plans into action. We have been fluctuating between orange and red levels of air quality index just today. Red is considered unhealthy. That means we have already initiated internal citywide coordination, including activating widespread public information and messaging through our social traditional media and our emergency alert notification, Alert SF. Throughout this incident, we will continue to push out messaging to the public so that everyone stays up to date on the risk level in the city and know how to protect themselves. If the air quality in San Francisco remains unhealthy or gets worse, we are prepared to respond by protecting the most vulnerable, assessing our existing operations, and ensuring the public gets the information it needs to stay safe. We will distribute personal protective equipment As the air quality continues to be unhealthy, we are distributing N95 respirators to our unsheltered population and our essential outdoor city workers for their voluntary use. We will evaluate our existing outdoor operations. If we reach an air quality level in the high red range, we may pull back some of our existing outdoor operations, such as neighborhood outreach and distribution of door hangers and flyers. We will activate respite sites. If we reach an air quality level of purple, which is considered very unhealthy, we will plan to activate cleaner air centers for temporary respite from wildfire smoke. These locations will be selected based on a neighborhood approach that focuses on the areas of highest needs and will be promoted through the community use. We will keep the public informed. Multiple times per day, we will issue updates on the current status of air quality in San Francisco and the actions that public should take to protect themselves. This information will be conveyed through our emergency notification system, Alert SF, and updates on our website, sf72.org, and our traditional and social media outlets. San Francisco is prepared because of years of planning and response to our changing climate. We have learned lessons from previous heat waves, air quality emergencies, and power outages. 2 years ago, after back-to-back years of devastating wildfires and resulting poor air quality, we embarked on a regional effort to ensure each Bay Area city and county were coordinated in our response to poor air quality. The resulting effort ensured we were all communicating the same health and safety guidance to our residents. I'm very proud of our regional efforts as they have laid the groundwork for continued successful response in San Francisco. We are also better coordinated because city departments and our partners have been united in our fight against COVID-19. Here at San Francisco's COVID Command Center, we work together every day to overcome the challenges of this global pandemic. This helps us work together in times of additional challenges like air quality and extreme weather. Finally, please remember that wildfire smoke is unpredictable. As we've seen today, we're going back and forth between air quality index levels, and residents should be on alert. And if you smell smoke, stay indoors with your windows and doors closed if possible. You can stay up to date by signing up for San Francisco emergency text alerts from Alert SF by texting the zip code where you live or work to 888-777. The Department of Emergency Management will continue to monitor and share information via these alerts, as well as updates to sf72.org. We all know that San Franciscans are resilient. We have taken such good care of each other through this global pandemic, and I know that no matter what emergency is layered on top of this one, we'll get through it together. Thank you.
Thank you very much, Director Mary Ellen Carroll. Now we will jump back to our original agenda, and I present to you Dr. Grant Colfax, Director of Public Health.
Well, thank you, and good afternoon, everybody. I'm Grant Colfax, Director of Health for the City and County of San Francisco. Thank you, Mayor Breed, for your leadership and direction, and thank you, Director Carroll, for your collaboration, partnership, and leadership during COVID-19 and now during these heat and smoke events. As has been said, there are currently multiple fires burning throughout California, including in Northern California and Santa Cruz County. Today, San Francisco is experiencing unusually hazy and smoky air as a result. The air quality index is currently at level red, which means unhealthy. In other words, everyone may begin to experience some adverse health effects, and members of sensitive groups may experience more serious effects. Members of sensitive groups include people with lung disease, including those who have asthma and COPD or emphysema, older adults, and children. These groups are particularly susceptible to elevated air pollution levels and should take extra precautions to avoid exposure. These individuals should avoid prolonged or heavy outdoor exertion, and people should limit prolonged exercise outside. If you have a respiratory illness, chronic or acute, please make sure you have an adequate supply of meds and contact your healthcare provider with additional questions or if you need refills. People should be cautious when they choose to go outside and wear a mask, and always be aware of whether you're having any challenges breathing. The air quality in our area changes daily and throughout the day as it is dependent on wind speed and direction. Air quality may improve at times or worsen very quickly, and we've seen that even today where we've varied between levels of red and orange. We are closely monitoring the air quality index and are prepared if our air quality index changes, as Director Carroll mentioned. Now, we must manage both poor air quality in the context of the COVID-19 pandemic. And as we have said with regard to COVID-19 for many months now, the best thing you and your family can do, if you are able to, is to stay at home. Even during days of poor air quality conditions, we must continue to protect ourselves and our community from COVID-19. During poor air quality conditions and COVID-19, the intersection of these concerns, the best and healthiest thing for everyone to do now is to avoid exposure to outdoor air and the virus by staying indoors as much as possible. If you must leave your home and go outside for essential activity, remember to bring your face coverings and socially distance from people outside of your household to protect yourself and your community from COVID-19. We continue to live in unprecedented times, and air quality is another challenge for us to address as a city. Please, again, stay at home if you can. And through social media or phone calls, please, virtually as much as possible, check on your friends, family, and neighbors, especially those people in your life who are older, pregnant, have respiratory illnesses, or are children. These are individuals who are at great risk of elevated air pollution levels and should take precautions to avoid exposure. The reality is that as we enter wildfire season and changing wind patterns, we will be living with both the intersections of COVID-19, poor air quality, and likely heat events for some time. We must stay vigilant and resilient as we take all actions to protect ourselves and our community from the elements. We continue to find ways to protect each other and our community, and we will continue to rise to the occasion as we continue together to work to slow the spread of COVID-19. Thank you.
Thank you very much, Dr. Colfax. Now I present to you the Director of Homelessness and Supportive Housing, Abigail Stewart-Kahn.
Good afternoon. Thank you, Mayor Breed, Directors Colfax and Carroll, for your partnership and leadership through these complex, multifaceted events. We've learned that San Francisco has heart. We've always known this. And we as a city need to continue to pull together to be nimble, compassionate, and responsive. Civil servants across the city, nonprofit CBOs, and neighbors are rising to this occasion today. And for that, we are grateful. As you've heard, COVID is still the #1 priority for all of us in our public health. We need to ensure we are caring for those most vulnerable due to COVID, heat, air quality, and other inclement weather events. During our heat emergency, our homeless outreach team, who are heroes even before the pandemic, have been activated their lower level extreme heat response. At this level, that activation included increased wellness checks, providing appropriate resources, and providing guidance on how to stay safe during COVID and the heat. Now we continue to shift that focus for air quality, and we're grateful for the support of HSOC and all of its partner agencies to augment the homeless outreach team's courageous efforts. Our department is working closely with the COVID Command Center to monitor air quality. And as Director Carroll shared, we strongly encourage everyone, housed and unhoused, to activate your alerts because it is changing by the moment. As you heard from the experts, we are currently at red level of air quality. Based on this and policy decisions, HOT team with support from HSOC will distribute appropriate resources. For the red level, this includes non-medical grade N95 masks and water and other resources. This is in addition to continuing to look for those who are vulnerable to COVID, to bring them indoors, and continuing to partner with HSOC to resolve encampments across HSOC's strategy. We're grateful to our partners at the CCC who will coordinate distribution of N95 masks so that we have access to these resources even as we speak, even though these are such a scarce resource. San Francisco is living its values by dedicating these resources to our unhoused neighbors, though we all know every civil servant at Mayor Breed's leadership wishes everyone could be inside to shelter in place. I want to pause and particularly thank the members of the homeless outreach team, HSH, and our nonprofit providers for continuing your work, for adding work on top of work to take care of those most vulnerable in our community. The city is exploring what to do and the next stages should air quality deteriorate further. The Human Services Agency is responsible for mass care and shelter and is evaluating alternative sites where people might come inside if we reach higher levels of air quality challenges. As you can see, many departments, many civil servants, many leaders, and many citizens are coming to the aid of our unhoused neighbors. While you should stay inside if you are housed, if you are outside and encounter somebody who is unsheltered, please encourage them to mask. Please talk to them and tell them that you see them. Ask them how their day is. Say good morning and good afternoon. The homeless outreach team, we hope, will be there soon to provide them a mask. We will continue to provide these updates through our boards, our governance authorities, and through our website. And we encourage all of you to stay connected through all of the various vehicles the city provides for up-to-date information. Again, thank you to Mayor Breed and to the leadership of the city for continuing to find another gear on which to keep San Franciscans safe and cared for. Thank you.
Thank you, Director Stewart-Kahn. We will now begin our Q&A portion. The first set of questions are for Dr. Colfax. They come from Dominic Fracaza with the SF Chronicle. Is the city prepared to shut down outdoor COVID-19 testing locations if air quality deteriorates?
So we are not currently planning to close any COVID-19 testing sites at this time. We are assessing the situation, and obviously testing and identifying those infected is and remains a top priority. We will continue to assess the air quality as things go forward with regard to any changes in our testing sites. But at this point, testing centers will remain open, and we will provide any updated information if that changes.
Mr. Fracaza's follow-up question is, what is the threshold for making such a decision, and how close is SF air quality to that point now?
Again, we are assessing the situation. Testing sites remain open, and if there are any changes, we will certainly make sure that people know that.
Thank you, Dr. Colfax. The following question is for Mary Ellen Carroll. One moment. If the city does open respite sites for residents to access safer air, how will the city mitigate the risk of COVID at those sites?
Thank you. We will follow all of the social distancing guidelines that already exist. We will do additional health screenings for anyone coming in. Many other jurisdictions regionally that are having much higher level temperatures have been doing this. And so we do have a plan and feel that we can do it safely should we need to.
Thank you very much, Dr. Carroll. Okay. It seems that there are no further questions at this time, and this will conclude today's press conference. Thank you very much, everybody, for your time, and please stay safe.